So today's lesson is regarding concussion, or as you'll see, traumatic brain injury and baseline testing. And we'll discuss some of the things that we do here at school in regards to this. So the LHSA concussion rule, which we abide by, is any player who exhibits signs, symptoms, or behaviors consistent with concussion will be immediately removed from a contest and will not play until cleared by an appropriate health care professional. We'll go through those healthcare professionals here in the next slides. So the first note that you're going to have to take down is this first bullet, which states that a concussion is a traumatic brain injury that interferes with normal brain function. One of the common misconceptions was that an athlete had to lose consciousness to have suffered a concussion, but this isn't the case. It's actually about 95% of them, they do not lose consciousness. So make sure you take down that a concussion is a traumatic brain injury that interferes with normal brain function. Symptoms that normally accompany concussion, usually after trauma to the head, include headache, fogginess, difficulty concentrating, easily confused, slowed thought processes, issues with memory, nausea, and lack of energy. And there's some more that go on with the next one. Additionally include dizziness, poor balance, blurred vision, sensitive to light and sound. The lights in the stadium may aggravate them. They may also have mood changes where they may be irritable, anxious, tearful. Somebody might be crying for no reason, or simply just really, really nervous, or just little things really can aggravate them. And the protocol which we adhere to states that no athlete will return to play the same day of a concussion, and if we suspect you of having a concussion, you'll be evaluated by an appropriate healthcare professional on that day. If no one is available, the head coach makes that determination, and we give them the head coach's education regarding concussions and head injuries prior to their sports season. And the protocol states that any athlete diagnosed with a concussion must be cleared by a medical doctor, MD, or DO, which must be licensed to practice in Louisiana before resuming participation in any practice or competition. And then after clearance, the return to participation goes through a stepwise protocol determined by the doctor or DO. Once again, must be licensed to practice in Louisiana. You can't get your aunt in Arkansas to clear you for a concussion. And if there are any signs or symptoms that return in that stepwise protocol, you go back to the next one. Interesting side note, one time from another institution actually had a guy who was a veterinarian tried to clear one of his relatives from a concussion, and that certainly can't happen. And those appropriate health care professionals that can determine whether you have a concussion are an MD, a medical doctor, a DO, doctor of osteopathic medicine, PA, which is a physician's assistant, nurse practitioner, an athletic trainer, and actually paramedic was taken off the list because they deal with different types of head injuries. And everybody must be licensed to practice in Louisiana. That's a key note. And that on-site health care professional is somebody from that list that we just went through. So RTP is return to play. That's that kind of stepwise protocol. A responsible individual becomes the head coach if there is no appropriate healthcare professional on hand. Somebody from that list, if somebody from that list is not available, the head coach becomes the responsible party. So it falls on their head. It falls on their head and shoulders if somebody's not there to appropriately diagnose you. And the official is also meant to be there to determine. The official, the referee, the umpire, if you get up a little shaky, they're supposed to always err on the side of caution and remove you from participation until you can be seen by somebody to make sure that you're okay. And once again, important to realize that only an MD or a DO is the one that's going to release you if you're diagnosed as having a concussion to return to play. So sometimes when we test people, they tend to look like this picture that you're looking like. They're giving you that kind of look of what's going on here. And we'll tell you how we test them on the field to determine whether somebody has a concussion or not. And touching on those signs again, it says card included in packet because we give this to a lot of the coaching staff, especially those that will deal with these, so they can be aware of them. This kind of goes back to those signs we talked about earlier. Appears to be dazed or stunned, confused about assignment, forgets plays, unsure of the game score opponent, moves clumsily, answers questions slowly. Sometimes whenever we're asking you questions, what we're trying to see how you respond to them. You may not be how you normally answer. Even temporarily loss of consciousness goes into play, shows behavior or personality change, and then forgets events prior to the hit, which is called retrograde amnesia. That's why that's in parentheses there. And forgets events after the hit, which is called anterograde amnesia. That's the parentheses there. And that's a lot of times it's your teammates that realize, wait a minute, something's not right here, and they kind of let us know what's going on. Moving on and on-field testing, we just finished signs. Now we go on to symptoms. Symptoms that are reported by the athlete after some trauma to the head for concussion would be headache, nausea, balance problems. These are things that we're going to test for. We'll ask if they have double vision, if the light or noise is sensitive. We kind of touched on that earlier. They also feel a little sluggish, a little foggy, kind of just want to go to sleep. A couple days later, they may experience a change in sleep pattern. Sometimes they can't sleep. And they also have concentration or memory problems, and we'll discuss how we test that in a second. So the questions that we asked to try and figure out how much the athlete didn't remember is we'll ask orientation questions, and the one that you show is what the card given that we give the coaches. Sometimes we'll ask these, sometimes we won't. But we'll ask the following questions. What stadium is this? What city are we in? Who's the opposing team? What month is it? What day is it? Then to see how their short-term memory is affected, we'd ask them to repeat the following words: girl, dog, and green, and we'll tell them to remember them. So we're going to try and find out exactly how much time they lost whenever after they hit their head. So we'll ask what happened in the prior quarter period. What do you remember just prior to the hit? What was the score of the game before the hit? And do you remember the hit itself? Because sometimes they don't recall the hit at all. And I'll also do a little different memory test that we'll get into shortly. So then you go through another cognitive task to keep them from kind of just repeating the words in their mind. So you'll ask them to repeat the days of the week backward, starting with today. So if today was Monday, you'd go Monday, Sunday, Saturday, Friday, Thursday, Wednesday, Tuesday. And then you'd ask them to repeat these numbers backwards. So you'd ask 63, and then they'd give you 36, and 419, and 914. So it's pretty comprehensive. So then you come back to, okay, what were the three words that we gave you before? And they should give you girl, dog, and green. And anything that they don't come back through should be considered abnormal. One of the things that I do is usually I'll give 3 colors and 3 numbers. And I'll go blue, gold, white, 5, 7, 9. And I'll say, give them back to me. They'll give them back, and I'll say, okay, remember them. Then I'll give them their cognitive task that I give is usually subtract from 100 by 5s, and they'll go 95, 90, that's fine. Subtract from 100 by 7s, 93, 86, very few people get 86, and I just say give me something close. And then I'll say, okay, what were the 3 colors and 3 numbers? And it was blue, gold, white, 5, 7, and 9. I've had something as subtle as we give somebody the 3 colors and 3 numbers, and they come back with blue, gold, white, 4, 6, 8. Let's try that again. And blue, gold, white, 5, 7, 9, and they go blue, gold, white, 4, 6, 8. Okay, that's you're not quite right, so we'll have to sit you out. So moving on to baseline testing, which is something we do here, and go ahead and take down the note that baseline testing is testing done prior to the beginning of an activity or season that gives you an idea where the athlete should be injury-free. It kind of tells us where you should be when you're in your right frame of mind. And there are several ways to do baseline testing. You'll see standardized assessment of concussion, balance error scoring system, which we do somewhat a version of. There are a whole bunch of paper and pen tests which you can use if you don't have access to computerized testing. We do a computerized test, which we're about to get into in just a second. And the computerized tests are the ANAM, the CogStat, Concussion Resolution Index, and the one we use is called the IMPACT test. and it tests 5 different components: verbal memory, visual memory, information processing speed, reaction time, and impulse control. And the impact test consists of 5 sections. The first one is it just kind of gets a health history and some demographic information. Then it goes through a symptom check and conditions, what's currently going on with you. Then it goes through neuropsychological testing, which we're going to talk about how it does that in a second. And then also asks kind of for an injury description, and then it gives you your test scores. So the first way the neuropsychological testing goes through, it first of all gives you 12 words, and it'll flash them on the screen. It'll show them on the screen, and it'll have you remember them. And then it'll ask you 20 questions. It'll say, was this one of the words shown? Was this one of the words shown? Then it goes to a design. It's a bunch of squiggly lines, and it'll show you the design on the screen. It'll have you remember it, and then it'll give you 20 different ones. And it'll say, was this one of the designs used? Then it'll give you a grid with X's and O's, and it'll highlight 3 X's and O's. And then it'll give you a task. You'll do the task, and it'll come back and it'll give you the grid, and you have to highlight the X's and O's that were shown. That's the one I hate the most. Then it'll give you a symbol matching. It'll give you 9 symbols with the corresponding number underneath. It'll have you click on each one, so you kind of get the idea of it. Then it'll take away the symbols, and it'll ask you where one was shown. Then it'll give you a color match, where if the word red is in red, you click. If the word red is in green, you don't click. And then the final one is a 3-letter memory. It'll give you 3 letters. It'll show on the screen for a little while. Then it'll give you another task, and you'll have to come back and put the 3 letters that are on. And then it goes back to the words that were shown at the beginning. And when it comes back to the words, you're kind of can't believe that it came back to that. But it's a very comprehensive test. Test itself takes about 20 minutes. We kind of go to a computer lab and put about 20 people at a time. One of the things we tell everybody that you need to take it seriously, and there are no wrong answers for it, because what we're trying to find out is where you are when you are in your right frame of mind, so we can check to see if you are near that, so we can return you safely to participation. And whenever I give this to coaches, it's a little different now. I think more people are taking head injuries very seriously. It used to always be, oh, I just got my bell rung, and that's kind of done now. The days of getting dinged are done. There are ways to be tested and tell whether somebody can be free of their concussion and return to participation. We use the computerized way, because for us, it's important to remember that a doctor must determine who can return to play after sustaining a concussion, and they'll forward it on to us. So we take these things very seriously, and one of the reasons is so we can avoid the issue that occurred in the video to begin the concussion information. If you catch it early enough, you can stay away from that. So.